Hi everyone, it's Dr. Powers here at the Ward Institute. I'm a facial plastic surgeon and today we're going to be talking about Sculptra. The name of Sculptra is also called poly-L-lactic acid. And a lot of our patients are coming in asking about this particular product. A lot of patients are getting what we call filler fatigue, where they're not really wanting to have something done where they're having an overfilled look. So this is a great alternative to that. Essentially what this is, poly-L-lactic acid or Sculptra, is a particular particle that gets injected. It's semi-permanent and then it's going to actually stimulate your own body's collagen production. So at first you may not notice any results, and then really over the next 6 to 8 weeks you're going to have new collagen production within your own skin. Why is this important? So after age 20, unfortunately, we all start losing collagen within our face. By about age 30, you've lost about 11% of the collagen within your face. By age 60, that goes up to 41%, and so on until you kind of really settle at about 61% of collagen loss. Oftentimes patients are saying they feel like they've lost kind of skin elasticity, they've lost the kind of dewy look to their skin, and their skin just overall looks like it has a weathered appearance. Sculptra is a great alternative in comparison to traditional filler in that it's not going to be overtly volumizing, but rather it's going to stimulate your own body's natural production of your collagen. Patients are oftentimes asking us, what are the complications of Sculptra comparative to normal filler? So traditional filler, which is a hyaluronic acid-based filler, can be dissolved. Sculptra, on the other hand, because it is stimulating your own body's collagen, is technically semi-permanent. However, the actual product that gets injected eventually gets reabsorbed by your body, but the collagen remains, and that's why it's semi-permanent. You're going to have a lot of swelling for the first couple days afterward. This is completely normal, and the reason this happens is because your own body is creating a reaction to that poly-L-lactic acid that's been injected into the face. That means that the collagen is starting to stimulate and that your own body's starting to actually make that new collagen, and it's starting to work. So when patients come in, I typically tell them you're going to be kind of bruised but really swollen for at least 5 days afterward. Additionally, because we are stimulating your own body's collagen production, we task you to do a little bit of homework yourself at home. So we want you to start massaging the area 5 times a day for 5 minutes for a total of 5 days. So it's the 5-5-5 rule. Essentially, that's going to help distribute the product, that's going to help your own body's collagen production, and ultimately give you really nice results. Patients that are coming in for Sculptra are patients that don't want an overtly volumized look. Actually, in reality, if you do Sculptra kind of on a regular basis, you're going to need less volumization over time. Patients that start coming in for Sculptra tend to be in their 30s for kind of a preventative, and then really we're seeing people into their 50s, 60s, and 70s who are wanting more of a restorative amount of volume, but also a restorative amount of collagen production. The most common type of complication after Sculptra would be developing a very small nodule afterward. And what that really is your own body that's created collagen in an asymmetric way afterward. We typically will treat this with, number 1, a lot of massage, and number 2, this can be treated with a very small amount of steroid injection directly into that little ball.